Communication is more than just words. It's the key that opens doors to understanding and connection. Imagine the impact when a child who once struggled to express themselves finds their voice. Who helps make these moments possible? It's someone with a deep passion for early intervention, a wealth of experience, and a dedication to empowering every child she meets. I'm Sophia, your host, and today on Enara Talks, we're diving into the world of transformative speech therapy with none other than Dr. Atoosa Zangeneh, Enara's very own in house senior speech language pathologist. With over 15 years of experience, Atoosa has been a guiding light for countless families, bringing hope and change through her innovative approaches. Let's hear her story and uncover the secrets behind these breakthroughs. Hey, Atoosa, welcome to Enara Talks. Why don't you start by giving us a little bit of background about your experience?
Hi, Sophia. I'm Atoosa, speech and language pathologist, and I have more than 15 years work experience working with children and their families who has different speech and language problems like speech delays, autism, pronunciation and articulation disorders, stuttering, and other neurodiversity problems. I'm also working in different settings like hospitals, governmental and private clinics as a senior speech and language therapist.
So, quite a bit of experience, and all in the UAE or anywhere else?
No, I start my career in Iran and then moved to UAE, and I'm currently working in Dubai.
Amazing. So, let's start with why is it important to notice early signs of speech or language delay?
Okay, it's actually a very good question. As we start to observe the child's development in different
Hmm.
stages, if we see that they have some missing milestones there, uh, we can reach out to that milestone as fast as possible. So we should be aware of these stages, and we should pay attention to their developmental process.
Hmm.
So if we see any sign of delay, then we can reach out for help or therapy or anything that those kids maybe need.
So, when you talk about milestones, what does that look like?
Um, we have different kind of milestones. We have speech and language milestones, communication one, behavioral and motor ones. But I want to specifically talk about the communication one, the speech and language milestones. We have different stages of growth that if child's meet it in a specific age range, then we will tick it and we will go for the next one. But if we couldn't see it or we couldn't see some of them,
Yeah.
then we will take it as a red flag or as a concern point.
Okay, but let's break this down to, let's say, 0 to 12 months. What are some of the key milestones in speech and communication that a parent should pay attention to or notice?
Yes, actually, it's a good way to go through it. From the beginning of the life to the 1 years old, child will start to make some sounds, make some repetitive sounds,
Hmm.
and they start to show eye contact. They have some facial expressions like laughing, wondering, looking, and also some gestures like pointing, like waving hands. And also, we expect some meaningful sounds, like, for example, saying mama, but not uh, as clear as mama or baba before 1 years old. So these are the main points if you want to pay attention before the first birthday.
Okay, and what does it look like between the ages of 1 to 2?
Um, Usually, by 1 years old, we expect children to have their first words.
Hmm.
And after that, they start to develop more and more till 18 months, 1 year and a half,
Okay.
that they should have approximately 15 words. And then after that, they should put these words together to shape the two-word phrases like mama milk or bye bye or more water. So they have different structures, but they are putting these two words together. Also, uh, by 2 years old, the child's speech should be clear for strangers. By strangers, I mean that the people outside the family. So usually, kids are understandable for their mom and dad and parents, but we are by being clear to strangers, we mean for those who actually rarely see the child, like
Hmm.
the other family members or friends or anyone else.
So you mentioned the number of words. How does it work if a child is raised in a bilingual home or multilingual home?
Very good question. So, usually some people misunderstand this, that maybe learning two languages at the same time will cause delay. It's not usually cause delay, as there are lots of kids all around the world now these days that they are actually learning two languages in the first time, maybe more sometimes. So it's not the reason of speech or language delay. It may be happen in the same time with the speech and language delay, but it's not the reason. So when we are talking about two languages in the same time, we should be aware that, for example, if the number of the words are 15, around 15, it's divided between these two languages. So we should not expect the child to have 15 words, for example, in English and in Arabic both. No. Generally, we should see them together, and yes, they should have 15 words. One more thing that I want to mention here is that when we are talking about words, we mean that the actually expression that childs refer to something always. So if they are using, if you want to say that child has a ball as a word, they should always refer to an actual toy or ball as a ball. They can't say ball to a ball or to a car also, or for example, to an apple. They should always refer to the exact object as a ball. In this case, we will count it as a word.
Interesting. I mean, I have so many questions around this. So, a parent may find that their child does, and oftentimes you get children who will refer to many things by the same name. With
Yes.
the example that you use, maybe they call a cup a ball,
Mhm.
maybe they call a ball, maybe they call something else a ball as well. I mean, many children do this in their early stages. When is it a point of concern for a parent?
Usually, after 12 months, between 12 to 18 months,
Hmm.
they should pay attention more to these things. Yes. For example, before that, maybe they call all of the women around mama. But after that, they should refer to their mom as mama and use another thing, another words for other ladies who they can see around them. So, usually we ask parents to be aware about the child's development and their words between 12 to 18 months, and pay more attention that are they using them in the way that we are mentioning or not.
See, we do get a lot of parents asking this question, and oftentimes it's natural human curiosity to ask, why do some children experience speech delays over others? And I mean, it's quite a loaded question because there are some common misconceptions, and maybe we can talk about that first. Uh, why some parents think their child has speech delays over others.
Um, it's actually a hard question to answer because there are so many contributors for speech and language development. So, finding the exact cause of this problem is not something really easy. But the first thing that I want to mention is that if parents feel that their child is different from the other kids, or the child is not clear for others, they can't actually engage in social activities. First of all, it's better to go to a pediatrician or speech and language pathologist for a quick screening. it's much more easier than start to have their own guesses or searching around, maybe in the internet or other sources, because it will make more confusion for parents. But if they directly go to a pediatrician, as they have experience, they can actually um, do some quick assessment and understand that is it really a speech and language delay, or is it really a big deal or a problem, or no. Because sometimes the kids are easily grow up from their problems. It's a minor thing that with some little consultation, parents can overcome it by themselves. But in the same time, sometimes it's really something that they should pay attention to it and seek therapy for it. So it's better to go to someone who is professional about this and ask their question from those. You talk about the causes of speech and language delay. Um, there are so many causes, by the way. Sometimes it's because of some background problem, like hearing loss, like different syndromes. Sometimes it's only some difference in development, and sometimes simply we don't have any answer for it. Um, it's better to focus on overcoming the problem instead of having this extra burden on themselves, that why it's happened.
Hmm.
Because I know that parents sometimes start to seeking for some reason, or maybe they blame themselves. I really want to ask them that don't do it. You're really great parents, and I'm sure that most of the parents that I have met during my life, they do their best to their kids. So it's better to leave it aside and focus more on how we can overcome these problems.
Okay, and does family history impact speech and language delays?
Yes, definitely. Um, it's a proven actually part that usually having someone in the family who has some problem with speech and language development may be affect on the other family members. But again, it's not something 100%. Maybe it's happened, maybe not. So if you have someone in your family, like brother, sister, nephew, niece, that has this problem, it doesn't mean that your child are going to have it too. No, it's a contributor. Yes.
Okay, it's a contributor, but it's not a definite.
No, no.
Right. And you mentioned a little bit earlier where you said parents should seek to speak to an expert if they have any concerns. When should a parent or a caregiver speak to a doctor or a speech specialist? What's the best time, or what are the signs when they should be looking to speak to an expert?
It's a very good point for parents to pay attention to communication style of their child, even from the birth. But we know that there are some very subtle differences before 1 years old. So maybe it's very hard for parents to understand it before 12 months. But after 12 months, as most of the kids are start to use their first words, it will become obvious that if your child is not using any word till 18 months, or they are using the words but not as an exact word as I described, not referring to the object or person, or if they are not clear enough for others. So these are the main signs that will give you this hint that, okay, let's talk to some expert about this and share your concerns.
And what kind of difference can early intervention make?
Um, Usually, we are always suggest that let's start therapy as soon as possible, because it has two main impact on child future. First of all, it will prevent the later problems that maybe your children are going to face.
Right.
Um, Imagine that child can communicate efficiently in nursery or in school, so they will have some other behavioral problem after that,
Hmm.
or they will have they won't have the good self-confidence. This is one of the most important one, and the other is that if they start intervention as fast as possible, the speed of development will be faster, and they will actually pass this gap much more easier in compared to those who start therapy later.
So, early intervention obviously makes a huge impact. What are some of the tips that we can share with parents that can help their child with improving their speech and language development?
I'm always saying this to parents that you are the most effective person in your children's life, especially in the communication development, because um, learn to speak, communication, and speech and language is something that we should learn to our kids. They will not learn it by themselves. So, the most important and easiest thing that they can do is talk to their kids. They can talk about anything that has happened around, about their daily activities, or if they are out, they can talk about what they can see, or even easily when their child is playing, they can talk about their actually playing and what is happening in between with simple and short sentences, because obviously they are kids and we should talk in their own language. The other thing that is very useful is storytelling. So if they can assign 1 hour or less during the day to sit with their child and start to read book, role play the books,
Hmm.
it will be great for their speech and language development. And also singing the songs and having these nursery rhymes, they will also great.
So, what are some of the tools or resources parents can turn to if they can't have immediate access to a therapist?
I'm always suggest that it's better to first go to a pediatrician or therapist, and then later from that point, if really having some regular therapy sessions are hard for parents, they can actually take advantage from their therapist suggestion that what they can do. So in this way, everything is better for their child, because the assessment will done and the specific needs that their kid maybe need during their development will be specified by therapists, and then they can use some other tools like books, like games, or even nowadays the online actually applications or platforms.
And with the changes you say about generations and times, I'm sure you're alluding to technology as well as our fast lifestyles. And, you know, we grow up internationally. I mean, ourselves, you and I, we come from different backgrounds. We're living here in a multicultural society and country. So, what are some of those things that are impacting uh, children's speech development?
Very good question. These days, usually, the size of families are become smaller.
Right.
So previously, maybe they all of us had 2, 3 siblings, and we have so many other cousins, and we grow in a larger and more busy families. But
Hmm.
these days, specifically after pandemic, these things change, and families are smaller, their relationships are less in compared to before, and mostly kids are busy with the technology thing, like playing with phones or other devices. So it will impact on their communication, because they are usually not communicating with people, they are communicating with devices. So we should take advantage of it and also be aware of it in the same time. So this is one of the most important one, and the other one, as you mentioned, now most of the kids all around the world face with this different languages in a society. So they are going out, they talk in another language, but maybe they are talking in some other language inside their families, especially in the country.
Hmm.
So we should also pay attention to this part. As I mentioned before, it's not going to cause delay, but it's going to change the way of speech and language development.
Thank you, Atoosa. I really appreciate you taking the time and sitting down with me to discuss early intervention and speech and language delays. I'm really looking forward to us discussing bilingualism next time.
You're welcome, Sophia. It was very interesting and fun for me, and I can't wait to do it again.
That brings us to the end of this enlightening episode. A huge thank you to Dr. Atoosa Zangeneh for sharing her wealth of knowledge and expertise with us. Her commitment to research and collaborative care truly inspires us all to push boundaries in supporting neurodiverse children. We hope her insights leave you with new perspectives on the power of speech therapy. See you next time with a new episode of Enara Talks.